Hi friends, I just wanted to hop on here real quick to talk about a common question I've been seeing, which is for people who have problems with heartburn, regurgitation, and acid reflux, what are the appropriate type of doctors that they should be seeing? And I'm going to answer a little bit differently than you might expect. You need to be able to find one or a combination of doctors in your area who can do these three things for you. Number one is functional testing. Number two is endoscopy, and number three is surgery. Now, believe it or not, these three skill sets might be mixed and matched into people with different specialty names, depending on that person's training, their exposure, if they've had a fellowship where these things were specifically focused on. And so you might be surprised to find that it's really, gastroenterologist in your community does maybe 2 out of the 3, or it might be a surgeon in your community that actually can offer all 3 of those different pieces of the puzzle. The point is that you don't know. And so rather than focusing on making sure you have just a GI doctor or just a surgeon, or just your primary care doctor looking into it and trying to help you figure it out, what you, rather than looking for the specialty, really need to ask, can my combination of doctors, the team of people that you might end up amassing for yourself, address these 3 important components of assessing the esophagus and looking for the appropriate signs, symptoms, functional outcomes, and treatment options for heartburn, acid reflux, regurgitation issues, esophageal issues. So when we talk about functional testing, this most commonly includes 2 things. One is esophageal manometry. That's a muscular function test that helps us understand how the motility, the function of the esophagus is doing, if it's abnormal, if that might be playing a role in the symptoms that you're having. The second piece of that is typically a pH test. It can be done during an endoscopy or separately. It can be done wirelessly or with a tiny catheter that is passed through the nose, a very tiny catheter. And there's different reasons to use different ones, and that's very individual, person dependent, which one the doctor might choose. But pH testing is essential because if we're looking for evidence of damage, we're thinking that fluid is coming out of the stomach into the esophagus, maybe causing damage, maybe causing precancer to develop. You really want to know if it's truly acid coming up there. And we need those markers, those pieces of information, to clearly diagnose you with the right disease before knowing what is the right treatment option for you. So, functional testing, someone that can do it, order it, understand it, interpret it. Manometry and pH testing. You need to have someone in your care team that can do those things. The second thing was endoscopy. So you need either a GI doctor or a surgeon who can and routinely does endoscopy, knows what they're looking for in the esophagus and the stomach, understands what the changes from acid-related damage might look like, or other diseases that might be occurring. Can assess the anatomy, can look for hiatal hernias, can measure them, knows what they're looking for. You need an experienced endoscopist. And finally, you need someone that can do surgery. So of course, typically that's going to be a surgeon. Just because you go and seek out a surgeon does not mean that you definitely need surgery. It doesn't mean that you failed in all your other better or earlier treatment options. Many times people seem to feel disappointed by the time they need to see a surgeon, thinking that they were not able to be successful any other way, and so this is a last resort. And from my perspective as a surgeon, I totally disagree with that. Surgery is part of the continuum of care that we provide for many, if not most diseases. And it's really important, especially in this grouping of disease processes where we know that cancer can directly develop by not taking care of these things early. It's really helpful and important to get the perspective of a surgeon if you are going down this pathway, because even if you stick with medical management for a while or you're doing reasonable with your symptom control, the The longer term treatments for acid reflux disease, many things that can result in the sensation of heartburn, rest with surgery. Now, there are some sort of procedures or surgeries that are emerging as more common based on using an endoscope, meaning you're doing surgery using an endoscope, but it's still a surgery. But that's still a small percentage of the overall reliable treatment options, more anatomical correction options for these diseases. And so if you don't have the perspective and opinion of a surgeon early on of what could be appropriate for you to think about and incorporate when the time is right into your treatment plan, you're really missing out a piece of the puzzle, and you might be prolonging your misery, your symptoms, your reliance on medication beyond when it might actually be really helpful for you, if you're not getting that full perspective of the continuum of how you might have options to take care of this disease process. So just to wrap it up here, I hope this is making sense for you. When you are looking for a doctor or a team for you, your personal team of people that you've seen in referral or consultation, to figure out and take care of your health problems that might be causing symptoms like heartburn that are known to be acid reflux or regurgitation issues, you need someone or a group of people that can do three things: functional testing, esophageal manometry and pH testing, endoscopy, and surgery. Hope that helps.